Good morning, folks. I must admit that I will miss not being able to watch a few of you fall asleep while I'm speaking. But one of these days, I should have that opportunity once again. Meanwhile, however, unless you have been living in a cave for the past 6, 7, 8 months, with no TV, no newspaper, no radio, no computer, no books, no magazines, and no friends, I would guess, and in fact I would hope, that we are all keenly aware of 3 huge national and international challenges. Namely, the ever-increasing awareness of the dangers posed by climate change, the coronavirus pandemic, and the long overdue national recognition of systemic racial injustice. All these merit serious discussion and bold action. We haven't time this morning for serious discussion of any of them, but in the next few minutes, I will suggest that these 3 issues are linked. All I can do this morning is touch on 2 such linkages. I will start with the linkage of racism and climate change. In 1975, Toni Morrison commented, "The very serious function of racism is distraction. It keeps you from doing your work. It keeps you explaining over and over again your reason for being." I will briefly amplify these remarks with the help of Ayanna Elizabeth Johnson, a marine biologist, policy advisor, CEO, author. She also happens to be a black woman. The sheer magnitude of transforming our energy, transportation, buildings, and food systems within a decade, while at the same time striving to reach net zero greenhouse gas emissions, is already overwhelming. And black Americans are disproportionately more likely than whites to be concerned about it and affected by climate crisis. But the many manifestations of structural racism, for example, mass incarcerations and state violence, mean that environmental issues are only a few lines on a very long tally of threats to black lives. How can we expect black Americans to focus on climate when they are so at risk on the streets, in their communities, and even in their homes? How can people of color effectively lead their communities on climate solutions when faced with pervasive and life-shortening racism? Toni Morrison reminded us, even at its most benign, racism is incredibly time-consuming. Black people don't want to be protesting their basic rights to live and breathe. They don't want to continually justify their existence. Racism, injustice, and police brutality are awful on their own, but are additionally pernicious because of the brain power and creativity that they steal from black people. Ayanna Johnson recalled a black friend of hers. She wanted to be an astronomer, but she gave up that dream. Why? Because she felt that organizing for social justice was more pressing. Consider the discoveries not made, the books not written, the ecosystems not protected, the art not created, the gardens not tended. Now here's the rub. If we want to successfully address climate change, we need people of color. Not just because pursuing diversity is a good thing to do, and not even because diversity leads to better decision making and more effective strategies, because black people are significantly more concerned about climate change than white people, and Latino people are even more so. To put that in perspective, it means that 23 million black Americans already care about the environment and could make a huge contribution to the massive amount of climate work that needs doing. People of color disproportionately bear climate impacts, from storms to heat waves to pollution. Fossil fuel power plants and refineries are disproportionately located in black neighborhoods, leading to poor air quality and putting people at higher risk for coronavirus. And it's another intersection of race and climate that doesn't get talked about nearly enough. Black Americans who are already committed to working on climate solutions still have to live in this country, in America, where they are brutalized by institutions of the state, constantly pummeled with images, words, and actions showing just how many of our fellow citizens do not, in fact, believe Black Lives Matter. Climate work is hard and heartbreaking, as it is. Many people don't feel the urgency, or they balk at the initial cost of transitioning our energy infrastructure without considering the cost of inaction. Many of us, I'm afraid far too many of us, fail to grasp how dependent humanity is on intact ecosystems. And then when you throw racism and bigotry into the mix, it becomes something nearly impossible. Johnson ends a recent opinion piece with these words: "So, the white people who care about maintaining a habitable planet, I need you to become actively anti-racist. I need you to understand that racial inequality is intertwined with our climate crisis. If we don't work on both, we will succeed at neither. I need you to step up, please, because I am exhausted." I will conclude my remarks this morning with a few thoughts on public health and racism. In doing so, I need to acknowledge Michelle Williams and Jeffrey Sanchez, both affiliated with the Harvard T.H. Chan School of Public Health. They reminded me of the seriousness of this linkage. To put it very bluntly and simply, racism is a public health crisis. Nowhere is that reality more gut-wrenching and visible than in the police violence that kills Black Americans at nearly 3 times the rate of white Americans. It is also apparent in the legacy of slavery and discrimination that persists in modern medicine and across the many social determinants of health. For example, across the country, Black Americans suffer from higher rates of diabetes, hypertension, asthma, and heart disease than white Americans do. They are more likely to be obese and to get insufficient sleep. Both can contribute to health issues. The role of racism in these underlying conditions simply cannot be denied. And there's still more. For generations, communities of color have faced vast disparities in job opportunities, income, and inherited family wealth. They are less likely to have housing security and access to quality schools, healthy food, and green spaces. All these factors undoubtedly undermine mental and physical well-being. And furthermore, we need to remember the words of James Baldwin when he said, "To be a Negro in this country and to be relatively conscious is to be in a rage almost all the time." How do people live like that? So it is that racism itself is hard on a person's health. Chronic stress caused by discrimination can trigger a cascade of adverse health outcomes. High blood pressure, heart disease, immunodeficiency, and accelerated aging. Evidence even suggests that the racism endured by black mothers contributes to the alarmingly high maternal and infant mortality rate. The COVID-19 pandemic has laid bare many of these inequities for the world to see. For example, we have learned that George Floyd tested positive for the coronavirus in early April, almost 2 months before his death. All told, black counties are seeing 3 times the rate of infection and 6 times the rate of COVID-related death as do white counties. I want now to borrow a comment from Martha Tartarnik, rector of St. George's Anglican Church in St. Catharines, Ontario. She remarks on frequently hearing 2 very different ideas from people. First, they express anxious questions about when can we expect to get back to normal. And second, the confident statements that we will be forever changed by this crisis. At one point, she then continues and confides this: the most troubling possibility is that this pandemic won't change anything in a lasting way. As we all know, black and brown Americans make up a disproportionate number of essential workers who have stayed on the job through lockdowns, and thus are at higher risk of contracting the disease. And when they do fall ill, they are more likely to receive worse care than do white Americans. It is simply an ugly fact of American life that black Americans are 75% more likely to live near a polluting facility, such as a factory or refinery. This in part explains why even before this pandemic, black children had a 500% higher death rate from asthma than white children. Did that number register? 500% higher death rate from asthma. As James Baldwin reminded us, not everything that is faced can be changed. Nothing can be changed until it is faced. And it is time now to face this immutable fact. Systemic racism has had its knee on the neck of the African American community since America began. And all of us, yes, all of us, have a responsibility both to acknowledge this and address it. My hope in sharing these thoughts this morning is that when our lives return to a more normal structure, we will not return to normal. We will be more aware of the injustices and dangers in our society. We will recommit to doing whatever we can to alleviate the obvious inequities and threats. We will take advantage of this inexpressibly unique opportunity we now have to stitch a new garment, a garment that fits all of humanity and all of nature. Thank you for listening.